Good day everyone, I'm Dr. Enoja, and today we are going to be treating how to do self-breast examination. Now, self-breast examination simply means you examine your breast by yourself to detect if there's any abnormality in the breast. To detect any abnormality, it's good you go to the hospital to leave a complaint where a professional will do the proper examination for you to detect if there's truly any problem there. And if there is, you treat it promptly to avoid the disease getting to an advanced stage where it becomes more difficult to treat. Please, if you are new to the channel, subscribe to my channel and click the notification button. Thank you. To do breast examination, there are certain things you have to keep in mind. One of them is first you are going to look at the breast, and in doing that, you need a mirror in front of you. Of course, you will not be wearing any clothes. You remove your shirt and remove your bra, so you'll be bare chested while in front of the mirror. Then the second thing you put at the back of your mind is you are going to feel the breast. You feel the top of your fingers and not the palm. Then you're going to do proper breast examination. You do it 7 to 10 days after you start seeing your menses. In that way, you can get the breast will be in its normal state where you can actually feel and then know if there's anything wrong. If you do it earlier or during your menses, breast becomes, most times breast is painful or it is fuller during menses. So you'll not get the accurate result if you do your breast examination during your menses. So let us start. The first thing I said is you see, you look. So in that you are bare chested, as I said earlier, stand in front of the mirror with your hands on your hips. You put your hands on your hip and then you examine the breast. You check for the shape. Are the shapes the same or is there any change in the shape of your breast? You check for the size. Is any of the breast bigger than the other? Or are your breasts getting bigger? Mostly for women, the breasts are not normally in the same size. So some women, the right-sided breast is bigger than the left-sided breast. Now, if your breast has always been this way, there's no need for alarm. They're supposed to know the size already. But if it is getting bigger than normal for the other breast, that is when you're supposed to be at alarm. And then do the proper thing by going to meet your doctor to give the proper examination. Now, you check the shape, you check the size, and the next thing to know is the nipples. Look at the nipple. Are the nipples retracted? Is it retracted on one side or on both sides of the breast? Are the nipples deviated? Then you look at the size of the nipples on the both breasts. Are they at the same height or one is bigger than the other? These are things that you look out for. Then you still look at the skin textures. Is there any change in the skin of the breast? Is there dimpling? Or if you are a fair person, is any side of your breast red? Or is one side of your breast appearing darker than normal? Now, as I said that I made in my previous video, you have where the skin of the breast will look like the back of an orange. These are early signs of cancer. I mean, is anyone like that? So these are things you look out for while doing breast examination by merely looking at it. So you check for the shape, the size, are the nipples retracted, are the nipples on the same level in terms of height. Then you check for the texture of the breast. Is any part red? Are they looking like the back of an orange? So these are certain things to look out for in just looking at your breast in front of a mirror with your hands at your hip. Then the next part you do is you raise your hands above your head. Now, you raise your hand above your head again. You check if the breasts are on the same level. You check underneath the breast what is going on under the breast. Is it normal? If it's not normal, then you take note of that. Then after that, you turn your axillary, your armpit. You turn your armpit towards the mirror. Check, is there any swelling under your armpit? If there's no, turn the other armpit also and check if there's any swelling under the armpit. The second part of self-breast examination is the part where you feel. Now you feel the pop of your fingers. Now what are you feeling for? You're feeling for, first, you're feeling for if there's any mass. You're feeling if there's any dimpling. You're feeling if there is any abnormality in the skin, the texture of the skin. Then you're also feeling for pain. So these are the things you have at the back of your mind when touching and feeling the breast. Now, if you're going to feel the breast, you feel the breast in circular motion. with the pop of your fingers. Then if you want to examine the breast, let's say for instance you want to examine the right side of the breast, your right hand will be behind your head this way, while the top of your left fingers use it to examine the breast. Now you examine the breast in circular motion. Examine the breast in circular motion. As said, you're looking for pain, you're looking for masses. And there's a precaution you should take note of. Do not pinch the breast between the thumb and then your finger, because if you do that, you'll likely feel lump, which is actually not there. So to give you a false finding, which will cause panic when there's no need to be. So do not at any point feel the pinch the breast between the thumb and your fingers. So after doing that, if you want to check the left breast, you put your left hand at the back of your head while you feel with the pop of your right hand, pop of your right fingers. Then after that, you feel towards your armpit also to see if there's any swelling in the armpit. Then also the two armpit, that you do that for the two armpit. And you should take note, there are some cancers that are actually not detectable with feeling, with all those self breast examination. So if you're at risk of having cancer, let's say you have family history of breast cancer, you can be going once, at least once in a year for a medical personnel to do proper examination on your breast. Then if you're above 35 years, you can actually do mammogram at least once in a year. So mammogram can even detect cancer at the stage where breast self examination cannot detect those early signs of cancer. So you go for mammogram when you're greater than 35 years old, and then you visit a specialist at least once in a year when you're at risk of um, breast cancer. So you should have this at the back of your mind. Self breast examination does not detect all kinds of cancer. Thank you very much.